So this is a really exciting time to be in genomics at the moment. There's so much happening. So what are the things that kind of excite you the most at the moment in the field?
Well, I mean, the thing is that this has exploded recently. So people are starting to sequence thousands of genomes all over the world. And people are now starting to ask new questions that couldn't be asked before.
Yeah.
And the things that we're seeing sort of, okay, new pieces of the reference genome, it turns out that we don't know really sort of the basis of the human genome yet.
Yeah.
So I mean, they're really exciting times.
Yeah. And what do you think are some of the biggest questions or unanswered questions that we need to focus on?
Well, I think one thing is that we need to think about how much is actually explained by the genome itself. I mean, we're doing all this sequencing and sort of looking at the mutations that we find, but maybe there are also other factors affecting this. It could be epigenetic changes or lifestyle. So, I mean, everything doesn't have to do with genetics. Perhaps we're staring sort of and being blind a bit about other things.
It's important for us not to get too tunnel vision into the genome. Absolutely agree with that. One thing I often wonder is that we are now sequencing thousands of other people's genomes and looking at their data and trying to interpret it. Have you had your own genome sequenced?
I haven't actually yet. I mean, it's something that I could do, but I'm a bit sort of, since I'm a bioinformatician, I'm very much into looking at the data.
Yeah.
So I'm a bit sort of afraid if I sequence my own genome, I will spend time analyzing that genome instead of doing the proper work that I should be doing.
You can do it in your spare time.
Yeah. Maybe. Yeah. And what about you?
I have had my, I have been genotyped on 23andMe many years ago. The information that they give back is a little bit controversial in terms of evidence for some things. Some of it's kind of just fun. That was years ago, and then recently I've had my exome sequenced with Helix, which is a new company that has a new model where you can have so the exome is all of your gene coding regions, not the whole genome, but it's a very broad test, and then you can choose which interpretation service you want to purchase after the sequencing is done. So it can be anything from your ancestry to your nutritional and exercise type information, and then you can even have carrier screening for rare recessive conditions and other products that range from recreational to medical. I haven't got any of those results back yet, but I think that it's actually very rare for someone working in genomics, well, quite rare for them to have actually had their genome sequenced and interpreted. Yeah. And I find that somewhat ironic. And so often I think, well, if we're not prepared to do it to our own genome, why should we expect other people to let us do it? And then you've got other people who are kind of would say, I would never do it for reasons X, Y, and Z, and yet we're expecting people to provide their DNA to us for research.
That's purposes. A very good point. Yeah.
And I think that's a little bit unfair sometimes. But then it's not actually that easy to just go and sequence your own genome, and there are ethical, for research ethics, there's certain limitations of what you can and can't do. But I sometimes think it would be interesting if all people working in genomics research would have their genome sequenced.
Yeah, maybe that's something we should do as a new project.
Yeah. Okay, great. Well, it's been great chatting with you, and it's wonderful to have you involved with Monash now with your adjunct appointment, and I look forward to working a lot with you in the future.
Yeah, thank you very much, Paul.
Cheers.
I'm really excited.
Cheers.